and the private sector has donated funds to the province in efforts to help curb the spread of COVID-19. We can tell you that 24 people are now confirmed to have died. The number of confirmed cases nationwide, 2,003. The Limpopo Health MEC, Poppy Ramatuba, joins us now via Skype to discuss how that funding is going to be used. MEC, good afternoon to you. So in terms of that funding there, what would your top priority be?
Afternoon, Jeremy, and afternoon to all your viewers at home. What we need to indicate and confirm is that we receive the donation in kind, because most of the donors, we preferred that they give us what we need, and especially our dire need was on the PPE, which has been making it difficult for especially our field workers who are supposed to embark on the massive screening and testing campaign as pronounced by the President. So we have received yesterday quite a number of surgical masks, and also we have received some N95 masks which are going to be utilized by our frontline workers, those who are taking care of mostly those who would be infected in the hospital. So we have actually received more protective clothing, which was our dire need, and of course even other support materials, as you have rightfully indicated, right. Fighting this COVID.
Are you satisfied, MEC, that you have enough people on the ground to comply with this new testing regimen that was announced by the President? Do you have the capacity?
Yeah, for now, what we can indicate in terms of the warm bodies, we have got over 10,000, I think it's 10,300 cadres who are currently employed as HAS Directorate. These are those people who would be doing door-to-door in terms of TB screening, HIV and AIDS, and recently there are those that we have trained to can deal with non-communicable disease. So we have, since the whole outbreak of COVID-19, recall them and start training them on how to screen for COVID-19, and we are confident that in terms of door-to-door, that number of 10,300 will be able to cover the province. And secondly, we also have 310 professional nurses. These are part of our tracer teams who will be assisting in terms of after the screening, and those who would be found eligible to can be tested. The 310 team of professional nurses are the ones that will be deployed across the province to be able to test, so that as the President pronounced, we've got to screen at the same time and test, so that we can have an idea in terms of the burden of disease, where are we as Limpopo? Because currently we know that from the tests that we've done, our cases are still at 24, but that is not actually probably the true picture. We can only get the true picture after we would have tested all those in the villages and in the township.
And your biggest problem, MEC, or one of your biggest problems that you've indicated, is that you're concerned that the number of people coming into the province from other areas could increase. Conceivably, they carry the coronavirus. What is your strategy?
Yeah, that is true, as confirmed by the fact that prior to the lockdown, our cases were at 11. And these past 2 weeks, we've seen the cases moving to 24. And these cases, even the 2 cases that we have in the past 24 hours, there are people who left Gauteng on the 26th, just before the lockdown. So you can see that indeed people have left other provinces without knowing their status, and they've come into the province. So our strategy is exactly what we have said the President has pronounced, to go in and screen and test everyone from our villages. And we are also monitoring any death that is happening in the province, so that should there be any death that could be suspicious with respiratory tract infections, we should be able to go deeper. But we are confident that up to so far, all the death that has happened within our facilities could be accounted for and we can't say COVID-19 is responsible. So our strategy would be, of course, the pushback strategy that you might have noted that the whole past 2 weeks the Premier has been working together with his cabinet and the entire police and the soldiers to try to assist our people to understand that what does it mean when we say total lockdown, so that they can stay at home, because if they stay at home, they will definitely not be infected.
Right.
And
MEC, thank you again. We're out of time and we are going to leave it there. But thanks for the update, and I hope the containment strategy works effectively. The Limpopo Health MEC, Poppy Ramathuba.